We've all had bad days, but to experience great discomfort and distress over a long time can be a sign of a mental disorder. Almost 50% of people will suffer from a psychological disorder at least once during their lifetime. Many of these psychological disorders are easily treatable if diagnosed early. The problem is, most of the time people are not sure whether their symptoms and distress are a transient state or a sign of an underlying disorder. Today we'll go over 3 major indicators that can help you determine whether you have a psychological disorder or just a transitory state of discomfort. If you or someone you know is experiencing mental distress in a way that meets all of these criteria, please seek professional help. Number 1. Functional impairment. Sometimes we lack motivation and are not in the mood to work. This could be a part of the natural cycle of life, or maybe we just need a break. However, if you feel like you're losing control of your life and your symptoms are interfering with your daily activities, this could be a sign of an underlying psychological problem. Functional impairment can manifest in many ways, such as difficulty going to work or school, maintaining relationships, or taking care of oneself. If you are constantly missing deadlines and are unable to manage your personal activities and social interactions as a result of your symptoms, therapy may be necessary in order to help you regain control of your life. Number 2. Persistence over time. If you go to a therapist, one of the first things she's going to ask you is how long you've had your symptoms, and have you experienced similar symptoms in the past. This is because many common psychological conditions, like depression, anxiety, and obsession, must last for weeks if not months, before being diagnosed as a disorder. Moreover, mental problems do not emerge out of the blue, and there are usually some markers and history of them beforehand. Just as your immune system can fight viruses, bacteria, and other threats to your physical health, your brain is usually capable of handling mental pressure and returns to its functional baseline after a while. However, if you notice that your symptoms are not going away, or are actually getting worse over time, this could be a sign of a mental disorder. Number 3. Environmental factors do not explain the symptoms. Going through significant life changes, such as a recent loss or trauma, can naturally cause mental distress. Additionally, long-term toxic relationships, constant work pressure and worry, can deplete your mental resources and energy for dealing with anxiety and stress. If there is an observable environmental element that can explain your emotional distress, you probably don't have a mental disorder. But you should not disregard your symptoms, as sustained stress can increase the risk of psychiatric problems in the future. If you like to support us and get more of our content, hit the subscribe button.